Hi, I'm Karen McClung, and my colleagues and I just returned from the American Society for Therapeutic Radiology and Oncology, ASTRO, meeting in sunny San Diego, which was buzzing with energy. The theme, Pay It Forward, partnering with our patients, was evident in the approach of each company and individual we connected with, and I'm excited to share some highlights with you. Let's start with TAE Life Sciences. They believe it's absolutely unacceptable to have to tell patients that their cancer can't be cured. TAE Life Sciences is dedicated to improving the lives of cancer patients by developing a biologically targeted radiotherapy, historically called boron neutron capture therapy, or BNCT, for treating cancerous tumors. BNCT has been used to treat recurrent, invasive, untreatable, and metastatic cancers while sparing healthy tissues, all within 1 to 2 treatment sessions. Their approach can provide a powerful new treatment option for all stages of cancers and help patients by working at the forefront of a transformation in radiotherapy, developing first-in-class targeted boron drugs that safely and efficiently target and destroy cancer cells while minimizing harm to healthy cells. We'll be watching as they build a global research consortium to perform clinical studies as they aim to gain approval and evidence to support approval in the US, Europe, and around the world. Next is Voximetry, which is developing a way to actually see the sensitivity of treatment for nuclear therapy and is able to provide never-seen-before imaging, allowing clinicians to better adjust their treatment based on the receptivity for each individual patient. With Torch, they aim to improve patient outcomes by moving beyond population-based models and making it simpler for clinicians to develop specific patient dosimetry-guided radiopharmaceutical therapy treatment options. This, combined with simple workflows and an easy-to-understand interface, will make Torch the standard of care preferred by providers and even payers who are seeking individualized treatment for a better value of care to maximize toxicity to tumors, reduce damage to critical structures, improve survival, and fewer side effects. Another showstopper was Ricoh's 3D printing for healthcare. Physicians can identify the size and location of a tumor by seeing it ahead of treatment, saving significant OR time. Ricoh asks, what if you could show a patient a precise replica of their surgical area and pinpoint exactly where you'd be operating to put them at ease and increase transparency? 3D medical modeling allows clinicians to see inside anatomy for greater visibility into patient needs, and patients understand their procedures better, which results in a smoother experience. Healthcare organizations, surgeons, med schools, and researchers can create 3D medical models without a large capital investment and design and print 3D anatomic models and files quickly with AI-assisted medical imaging. Ricoh's production facility can print for the provider, or some are now simply printing on site at point of care. To all the incredible people I met at ASTRO, thank you for sharing your insight with me. I'm so appreciative of the passion behind treatments in oncology because, on a personal note, my mom is in remission from cancer, and I can't thank each of you enough for ensuring progress continues to be made in this space until a time where cancer is eradicated. Sorry, guys. While my colleagues and I tried to see all of the latest advancements in person, we know we didn't get to capture everything, so if you have something buzzworthy, send me a message or comment below so we can share your innovation. Thank you.